Hello everyone, welcome to last rapid recall NEET-PG 2023 discussion. Last set of question 176 to 200. So starting with question number 176, patient alcoholic man presented with great toe pain, uric acid normal, synovial fluid, raised WBC, no history of fever, trauma or dysuria. So probable diagnosis, it is a case of gout, great toe pain, raised WBC, alcoholic men. As 177 was Melanie gangrene, image based question was there, I think. Actually my juniors couldn't remember the options, which are the options that were given actually in the real exam. So if you can tell what are the four options that was given during exam, so I can tell which is the true statement about Melanie's gangrene. So one question was about Melanie's gangrene. So next question 178, base test for herpes encephalitis, it is CSF DNA PCR, base test for herpes encephalitis. Another similar type of question on meningitis, viral meningitis, child presented with fever, neck rigidity, temporal lobe enhancement and MRI. So fever, neck rigidity, temporal lobe enhancement and MRI, probably temporal lobe encephalitis due to herpes simplex virus. Okay. So next, coming to question number 180, Rinne's test positive for 124 Hz, negative for 256 and 512 Hz. So airborne gap will be problem based question, airborne gap of 30 to 45 decibel. Coming to question number 181, image based question was there, corneal ulcer was there. The question asked was about the name of the dye and technique used. The image shown fluorescent dye along with cobalt filter image, fluorescent dye and cobalt filter technique. Next, coming to question number 182, cirrhosis with portal hypertension. So what is the anastomosis that has to be done to control the esophageal variceal bleeding? I think that question was asked. So left gastric esophageal anastomosis. Next, 183, hepatitis B treatment, patient with hepatitis B surface antigen positive, also envelope antigen positive, it is tenofovir for more than 50 weeks. I think more than 50 weeks was mentioned. Next, one question from obstetrics, transverse lie or adequate, weight of the baby 2.8 kilogram at 36.6 weeks of gestation and with history of previous normal delivery. So in this case, what will be the best next management? That is external cephalic version, transverse lie with history of previous NVD at 36 weeks with adequate liquor, you can go for external cephalic version. Next one question was from partogram. I think partogram was showing obstructive layer as recalled by my juniors. So if it is a case of obstructed liver in a partogram, you should do immediate cesarean section. So the answer is immediate cesarean section. Another image based question was from gynecology, that is about labia swelling. So that is swelling in the labia, that is Bartholin abscess. I think this was clear cut image. This image may not be exactly similar, but similar type of image was there, labial swelling, Bartholin abscess. 187, 1 year adequate growth is denoted by, that is length increases by 25 centimeter. As you know from the developmental milestone and growth chapter, during birth the length of the baby is almost 50 centimeter, and the end of 1 year we can expect 75. So length should increase by 25 centimeter. Next, coming to question number 188, patient for in vitro fertilization on HMG coming with nausea, vomiting, abdominal pain, and ultrasonography of the ovaries shows this multiple cystic lesion. This is typical presentation of OHSS, ovarian hyperstimulation syndrome. So this is ovarian hyperstimulation syndrome because of hormonal stimulation, patient presenting with nausea, vomiting, abdominal pain, even shock, shortness of breath, everything can happen. So this is OHSS, ovarian hyperstimulation syndrome. Then another controversial question, So many of you are making this question controversial. I think radius lower end distal radius X-ray was given, and the question asks the type, which is the diagnosis. It may be GCT or giant cell tumor, aneurysmal bone cyst. Some of the faculty is telling and students are telling there was soap bubble appearance, so it is a case of GCT. Some of the students are telling it is epiphyseal lesion, maybe GCT. Someone is telling no, it is only metaphyseal and the physis is thin, it is aneurysmal bone cyst. So it depends on the clinical scenario how the question was formed. So maybe GCT or aneurysmal bone cyst, I don't know, because this time in exam was not given by me, because I am already doing my residency in medicine, internal medicine. So you may know better what was the actual question. So I am keeping this question controversial, maybe GCT or aneurysmal bone cyst. Question number 190, baby with obstructive jaundice, increase alkaline phosphatase, ALT/AST normal, pale stool, and on histopathology bile duct proliferation and biliary plug is found. The diagnosis is extrahepatic biliary atresia. Extrahepatic biliary atresia. So baby, ectatic baby, pale stool, increased ALP suggestive of obstruction, ALT/AST normal, biliary plug, bile duct, all goes for the answer of extrahepatic biliary atresia. Then middle-aged male, I think, presenting with backache, recurrent red eye, X-ray image was, I think, image-based question was there. X-ray either bamboo spine or dagger sign, some image was there. So backache, inability to bend forward, red eye is extra articular manifestation of AS, ankylosing spondylitis. So this is a typical presentation of ankylosing spondylitis, image-based question. 192, alcoholic patient presenting with weight loss, increase ALT/AST normal and alpha fetoprotein raised. This is cancer marker. As you can see, weight loss is another signs of malignancy. So alcoholic men more prone to develop in long term basis hepatocellular carcinoma, and this is alpha fetoprotein, one of the important tumor marker for hepatocellular carcinoma. So it is hepatocellular carcinoma. Alcoholic patient with weight loss, increase AFP ALP. Next, coming to question number 193, mother presented with mother as history of cervical cancer. So mother, now what will you advise to her 14-year daughter? So advice to daughter, so best advice to daughter is to take HPV vaccine. So you should advise daughter to HPV vaccine for prevention of cervical cancer. 194, sweat chloride test, it is definitely cystic fibrosis. Sweat chloride test, straightforward question done for cystic fibrosis. X-ray, I think on X-ray image was there, scalp swelling since birth, image based question, and the condition asked, I think it was calcified cephalohematoma. I think some more clinical clinchers or clues are there, not crossing midline. Another is X-ray, it is calcified, that was more prominent in X-ray, like something like this. So it is most probably cephalohematoma. Also, so many of you are also making this question controversial, but according to me, I think as I have received response from my juniors, probably it was a case of cephalohematoma. So since birth, after so many days, even after I think 1 month, 2 months, the swelling is remaining. Maybe it is calcified hematoma, not crossing the midline. Next, it cannot be caput succedinum because it resolved after few days. Subgaleal hematoma and all less likely because it is devastating. Patient presented with shock after 1 or 2 days, and it's more likely to a case of cephalohematoma. Next, disadvantage of laparoscopic surgery, delayed recognition of electrosurgical burns. 197, resting tremor, rigidity, expressionless face. So diagnosis is definitely Parkinsonism. The question asks lesion, where the lesion is found, it is basal ganglia. Okay, basal ganglia. Next is ulcer on foot, DM and diabetes mellitus, callosity, it is trophic ulcer. So I think trophic ulcer, did image based question was there, trophic ulcer. Then Fournier's gangrene, true statement was elderly diabetic Fournier's gangrene. I think this was also image based question. Fournier's gangrene, it is caused by mixed infection, both aerobic and anaerobic. So coming to the most awaited last question, but before that I just want to thank you everyone for subscribing my channel, and please do also follow the popular videos with more than 7 to 8 lakh views, like neonatal reflex, very popular video for MBBS undergraduates, also how to do intravenous cannulation, how to, and a day in a life in a doctor at SNSU. So do watch these videos, and I hope you will enjoy, and do share the videos with your friends, juniors and seniors, and subscribe my channel for more videos on NEET related topic and also clinical aspects and other aspects of medicine. So do subscribe my channel. So last question number, much awaited number 200. So patient presenting with chest pain radiating to interscapular region, mediastinal widening was there, BP difference in upper limb and lower limb. It is a case of aortic dissection. So that's all. It is a case of aortic dissection. Thank you everyone for your patience.